This initiative to design to improve the knowledge, practical skills of medical laboratory technologists who are working professionals, MLT students, or preparing for any kind of competitive exams in India or abroad. Unlike many online platforms that only provide notes and MCQs, our focus is on clearing concepts in a simple and practical way so that learner truly understand the subject, not just memorize a common concept if you agree. Hematology is one of the most important and core branches of laboratory medicine. It plays a critical role in diagnosing diseases related to blood, bone marrow, and hematopoietic system. In this video, we will cover what is hematology, branches of hematology, common hematology tests, clinical significance of these tests, and the role of medical laboratory technologists in a hematology laboratory. This video is completely educational and designed especially for MLT, DMLT, BMLT, and paramedical students. Hematology is the branch of medical science that deals with the study of blood forming organs, and blood disorders. It includes the evolution of red blood cells, white blood cells, platelets, hemoglobin, plasma proteins, and coagulation factor. RBCs are like oxygen delivery trucks. Its lifespan is 120 days. WBCs are the soldier of immune systems. Different WBCs have different lifespans, like neutrophils has 1 to 2 days, eosinophils approximately 8 to 12 days. Basophils can survive for 5 days. Monocytes 1 to 3 days. Lympho TNB cells lives weeks to years. Platelets act as emergency repair workers. Its lifespan is 7 to 8 days. Hemoglobin is an oxygen carrier. Hematology helps clinicians diagnose conditions such as anemia, leukemia, infections, bleeding disorders, and clotting abnormalities. In anemia, oxygen carrying capacity decreases. In leukemia, there is uncontrolled proliferations of abnormal cells. Bleeding disorder and clotting abnormalities, like in hemophilia, in even minor injuries can cause prolonged bleeding disorder. Hematology is broadly divided into the following branches. Clinical hematology, concerned with diagnosis, management, and blood disorders such as anemia, leukemia, and thrombocytopenia. Hematopathology requires strong microscopic skills. Coagulation and hematostasis, disease with clotting mechanisms, bleeding disorders, thrombotic conditions. Transfusion medicine, immunohematology includes blood grouping, cross-matching, antibody screening, and blood transfusion services. Pediatric and special hematology focus on inherited blood disorders like thalassemia, sickle cell anemia, and hemophilia. CBC is the most frequently ordered blood test worldwide. One of the most commonly performed tests includes hemoglobin, total RBC count, total WBC count, platelet, hematocrit, PCV, means packed cells volume, red cells indices, MCV, MCH, MCHC. It is very important for examination. Even simple fever causes start with CBC. Red cells indices helps us differentiate iron deficiency anemia from B12 deficiencies. MCV means mean corpuscular volume. It is directly proportional to size of RBCs. MCHC is a hemoglobin contents, and MCHC is a mean corpuscular concentration of hemoglobin. We will make a separate video for red cell indices in future. Peripheral blood smears is the confirmatory eye of the hematology lab. Analyzers gives numbers, but smear shows morphology. Microscopic examinations of stained blood cells helps assess RBC morphology like microcytic, macrocytic, and isocytosis. In WBC divisional count, we count separately neutrophils, eosinophils, basophils, lymphocytes, and mono in 100 numbers of cells. Platelet estimation is very important for dengue. Low platelet count leads to internal bleeding. Low platelet counts is a thrombocytopenia. ESR, erythrocyte sedimentation rate. ESR is a non-specific test for inflammation. It does not diagnose the disease alone. It indicates that something inflammatory is happening inside the body, like chronic infections, tuberculosis, autoimmune disorders like rheumatoid arthritis, and malignancies. Coagulation profiles. Coagulation profiles includes PT, INR, APTT, bleeding time, and clotting time. Prothrombin time works for extrinsic pathway. INR is used for warfarin therapy. APTT is a part of intrinsic pathway. Coagulation studies is very critical in ICU and surgical patient. Special hematology test. Reticulocyte count. It indicates bone marrow activity, bone marrow aspiration, and biopsy. It is a gold standard for many hematological malignancies. Hemoglobin electrophoresis. It is important for thalassemia diagnosis. D-dimer. D-dimer helps rule out the thrombosis. Sickling test, osmotic fragility test. We will make a separate video for these two tests. Hematology tests are essential for diagnosing anemia and its types, detecting infections and inflammatory conditions, identifying leukemias and blood cancers, monitoring chemotherapy and drug therapy, diagnosing bleeding and clotting disorders, evaluating nutritional deficiencies such as iron and B12 and folate. Accurate hematology results directly influence clinical decision making and patient management. A medical laboratory technologist plays a crucial role in the hematology laboratory. Hematology tests are not just a report, they guide treatment decision. Key responsibilities include proper sample collections, anticoagulant usage like ATT and citrate, operation and maintenance of hematology analyzers, preparation and staining of peripheral blood smears, manual cell counts, and verification of abnormal results, quality control and calibration of instruments, reporting critical values promptly, maintaining laboratory safety and biosafety standards. A hematology analyzer can generate results, but interpretation and validation depends on the technologist. MLTs act as the backbone of diagnostic hematology, ensuring accuracy, reliability, and precision of test results. Hematology is a vital pillar of laboratory medicine. From routine blood tests to complex bone marrow examination, it helps early diagnosis, disease monitoring, and treatment planning. For medical laboratory technologists, strong knowledge of hematology is essential for professional competency and career growth. Understanding hematology means understanding life itself because blood sustains every organ of the body.